Hello, and welcome to an overview of purchasers and payers of medical technology, Part 1. My name is Franziska Möckel, and I am a reimbursement and regulatory specialist for diagnostics within the Small Business Education and Entrepreneurial Development, or SEED office. So let's get started. As part of this presentation, we will cover two topics as Part 1, who purchases and pays for medical technology, as well as how medical technology is purchased. And then in Part 2, we will cover who makes reimbursement decisions and for whom, and why it is important to understand the US healthcare market. So hopefully from this presentation, you will come away with an understanding of who buys medical technology and recognize the role of third-party payers and how they influence purchasing decisions. When you think about who the purchasers and payers of medical technology or devices are, you may think about hospitals or healthcare providers. You may think about health insurers, or as we call them, payers. And you may even have heard about the Centers for Medicare and Medicaid Services, or CMS. You've probably also thought about how to manufacture your medical device or diagnostic, and as part of that, contemplated FDA's role in getting it to market. And yet, there is so much more, and all these players create an incredibly complex healthcare market that probably makes your head spin just by looking at this landscape. It surely does for me. Now let's take a closer look at these groups. At the highest level, you can group them into 4 buckets of players, and this is all from a reimbursement standpoint. We can think about them in terms of consumers, third-party payers, healthcare providers, and vendors. Let's start with consumers. You may think about patients who receive a medical device as part of their care at a hospital or physician's office. However, it also includes individuals who purchase medical devices over the counter from a retail store, for instance, or pharmacy, and pay out of pocket for them. Now, healthcare provider, on the other side, they use FDA-approved medical devices based on those labels, and they apply the practice of medicine. You probably see their academic medical institution and think about conducting IRB-approved research with medical technology. However, for this purpose, we will focus on reimbursement and those aspects of this landscape. Now, vendors, they offer a venue for healthcare providers to get or purchase medical devices. So let's take a closer look there. They may be group purchasing organizations, or GPOs, and that is a group that provides contracts to healthcare providers in order for them to purchase products, usually in bulk, so that they can benefit from discounts. And it may also include distributors or suppliers that include medical device manufacturers directly in some instances. One of those instances are catheters. And lastly, third-party payers. So how do healthcare providers get paid, if you will, for the medical devices that they purchase from vendors and use in patient care? That is where so-called third-party payers come into play. They include the Centers for Medicare and Medicaid Services. They are public payers, as well as commercial or private payers, such as employers. To get a better understanding of who purchases and pays for medical technology, let's take a closer look at these 3 buckets here: consumers, vendors, and healthcare providers. When you think about consumers, you can think about them as buying medical technology one at a time. And here it is important to understand that this may include individuals with insurance or without, or the uninsured. So individuals who have insurance may opt to use it when they receive a medical technology as part of their care in a hospital or in a physician office, but they also can opt to pay out of pocket and purchase medical technology over the counter, for instance, at a retail store, as we discussed, or over the internet. And that also includes the uninsured. So individuals who do not have insurance, they can still receive medical technology as part of their care. They just have to pay out of pocket for them. And individuals or consumers have the opportunity sometimes to purchase these medical technologies directly from suppliers. And we gave the example of urinary catheters that are prescribed by physicians. But that is sort of an outlier. And I like to group them into or say that they are an end user. They're really the beneficiary of the medical technology. Now, vendors on the other side, they offer healthcare providers an opportunity to buy in bulk. They are group purchasing organizations, distributors or suppliers and wholesalers, and in other words, they're the resellers. They sell to consumers, healthcare providers, or even third-party payers. Then healthcare providers on the other spectrum, they buy just in time and mostly, as we said, in bulk. And this is because they want to take advantage of discounts. And healthcare providers, when we say that, that can entail a hospital or hospitals, physicians' offices, or pharmacies. And I'd like to think of them as the end user or influencer of medical technology, as they're using medical technology in patient care, and physicians can make decisions as to which medical technology is used for patient care. Finally, let's talk about third-party payers who indirectly influence purchasing decisions. They pay as part of a service for medical technology. And this is in contrast to what we talked about earlier in terms of consumers, vendors, and healthcare providers having this direct relationship within each other, with each other, and purchasing relationship. Third-party payers purchase services from the healthcare system that may have included, for instance, as part of a hospital stay, a device that was implanted. However, they do not pay manufacturers directly for most technologies. It is also important to understand which of the third-party payers indirectly influences purchasing decisions. In the middle here, we have a table with different payer types. On a broad scheme, we can categorize them into private or commercial payers and public payers. A great example of a private payer are employers. It's probably the category you're most familiar with. It can entail private entities, nonprofits or religious entities, and also government employees. So that is really where this funding source comes from, when an employer offers health insurance to their employees. Another example are non-groups, as we call them. Those include small businesses and individuals. And here, these entities, the non-groups, purchase health insurance through the marketplace. On the other spectrum, we have public payers. This is where the Centers for Medicare and Medicaid Services come into play, or CMS. Medicaid and CHIP, or Children's Health Insurance Program, is one such example. Here, the funding source, interestingly, comes from federal and the states. So they have a sharing of the funding source and split 50-50. Medicare, on the other hand, is federal. So is the military. We also included as a payer type the uninsured here, so individuals, because technically when you pay out of pocket, you're still a payer in essence. This wraps up part 1 of purchasers and payers of medical technology. We hope that you got a better understanding of why we say we operate in an enormously complex US healthcare market with an enormously diverse market in medical devices or technology. We talked about these 4 groups: consumers, vendors, hospitals and providers, and third-party payers. In further detail, we talked about consumers, that they can buy medical technology one at a time and are the end users or beneficiaries of medical technology. They may include individuals with insurance or those who are uninsured. Vendors, buy medical technology in bulk from manufacturers and resell it to healthcare providers and consumers. They can also, in some instances, get paid by third-party payers directly. Now, healthcare providers buy medical technology usually from vendors and just in time and in bulk to benefit from volume discounts. So hospitals negotiate contracts with private and commercial payers for those medical devices, and so that they can get reimbursed. Now, third-party payers, lastly, include private and public payers and provide the insurance plans for specific patient populations. They do not buy medical technology directly from manufacturers, as we talked about. Rather, they reimburse hospitals or providers for their services that may include medical technology, and this is based on the patient's insurance plan. And if you still have questions after listening to this recording, you can always reach out to us and request a consult with someone from our team.